term periodontium is a combination of two Greek words, peri meaning around and odont meaning tooth. Therefore, it can be simply defined as the tissues investing around and supporting the tooth. The periodontium consists of four principal components: the gingiva, the cementum, the alveolar bone, and the periodontal ligament. The gingiva covers the alveolar bone and the root up to a level just coronal to the cemento-enamel junction, or the CEJ, that is the junction between the enamel-covered crown and the cementum-covered root. The second component of the periodontium is the cementum, which is a calcified layer of tissue covering the root. The third component is the alveolar process, or the tooth socket into which the root fits, and the fourth is the periodontal ligament, which is a group of specialized connective tissue fibers that provide the main support of the tooth by attaching the bony socket to the cementum of the root. Collectively, the tooth and the periodontium supporting it are termed the dentoperiodontal unit. Okay, so before we delve into the periodontium, let's take a brief look at the wet soft tissue mucous membrane that lines the structures within the oral cavity, that is the oral mucosa, of course. Histologically, the oral mucosa is classified into three categories: lining, masticatory, and specialized mucosa. The masticatory mucosa includes the gingiva and the covering of the hard palate. Its boundaries are from the free gingival margin to the mucogingival junction on both facial and lingual surfaces. The mucogingival junction is the distinct line between the attached gingiva and the alveolar mucosa, which is the mucous membrane located apical to the attached gingiva and extends into the vestibule of the mouth. The alveolar mucosa is darker red and movable because it has no elastic fibers. However, there is no mucogingival junction on the palatal side, because palatally, both the gingiva and the alveolar mucosa are of the same type. The tissue of the masticatory mucosa is firmly attached to the underlying bone and covered with keratinized epithelium to withstand the frictional forces of food during mastication. The specialized mucosa covers the dorsum of the tongue and contains nerve endings for general sensory reception and taste perception. Finally, we have the lining mucosa, which is the oral mucous membrane that lines the remainder of the oral cavity, such as the tissues covering the lips, cheeks, floor of the mouth, inferior surface of the tongue, and the soft palate. Okay, back to the periodontium, starting with the gingiva. So as we have mentioned before, the gingiva covers the alveolar process of the jaws and surrounds the necks of teeth, and its main function is to protect the teeth and the structures of the periodontium from mechanical trauma and microorganisms. Anatomically, the gingiva is divided into three types: marginal or free gingiva, attached gingiva, and interdental gingiva. Each type exhibits considerable variation in differentiation, histology, and thickness, depending on its functional demands. The marginal or unattached gingiva is the terminal edge or border of the gingiva. It surrounds the tooth in a collar-like fashion, but it is not attached to it, because there is a fine space called the gingival sulcus separating it from the tooth. The marginal gingiva is about 1 millimeter wide and is separated from the attached gingiva below it by the free gingival groove, which is a shallow linear depression on the facial-lingual surface that roughly corresponds to the base of the gingival sulcus, and is found in about 30 to 40% of adults. The gingival sulcus is the space or shallow crevice that is bounded by the tooth on one side and the epithelium lining of the free margin of the gingiva on the other side. It is V-shaped and barely permits the entrance of a periodontal probe. Under ideal conditions, it is about 0 millimeters deep, which is only seen in germ-free animals or after intense and prolonged plaque control. Clinically, the depth of the sulcus, as determined in histologic sections, has been reported as 1.8 millimeters. In order to evaluate the depth of the sulcus, we use a periodontal probe that we insert into the sulcus. The estimation of the distance it penetrates is called the probing depth, which is about 2 to 3 millimeters deep. However, the penetration of the probe depends on several factors, such as probe diameter, force, and the level of inflammation present. Therefore, the probing depth and the histologic depth are not necessarily the same. The attached gingiva is the second type of gingiva. It is continuous with the marginal gingiva, and it is firm, resilient, and tightly bound to the underlying periosteum of alveolar bone. Coronally, it is demarcated from the free gingiva by the free gingival groove, and it extends apically to the mucogingival junction, where it becomes continuous with the alveolar mucosa. The junction between the attached gingiva and the alveolar mucosa is called the mucogingival junction. The width of the attached gingiva is the distance between the mucogingival junction and the projection of the external surface of the bottom of the gingival sulcus, or the periodontal pocket. A pocket is a pathologically deepened gingival sulcus. The interdental gingiva is the third type of gingiva, which fills the space between the adjacent teeth. It consists of two pyramidal papillae separated by a central caul, a valley-like depression that follows the shape of the interproximal contact. When the teeth are not in contact, the caul is often absent, but it may also be missing even when the teeth are touching. The facial and lingual surfaces of each interdental papilla tapers towards the interproximal caul area. The lateral borders and the tip of the interdental papillae are often formed by the continuation of the marginal gingiva from the adjacent teeth. In the absence of proximal tooth contact, the interdental gingiva is firmly bound over the interdental bone and forms a smooth, rounded surface without papillae or a caul.